Thank you for watching. This is, I guess, the second episode, if I want to call them that, of Cancer with Kaylee. I might not keep that, we'll see. But anyway, I just wanted to thank everybody who watched the first video, and thank you for the questions that I got, and I will address those in future videos. Today I wanted to get into just my first cancer diagnosis, and then also why I got cancer. I decided to not just have one long video that's a litany of like this went wrong and this went wrong and this went wrong. So I'm going to try to organize my various treatments and decisions into more sensible chunks than how they came at me in the first place. So people are often curious how I actually found out that I had breast cancer, since I was so young at the time, and certainly not somebody who gets a yearly mammogram or anything like that. So actually I'm pretty lucky because my tumor hurt, and funnily enough, at the time, everything I found on the internet said, if you have something in your breast and it hurts, that's great, it's probably a cyst, cancer doesn't hurt. And luckily mine did, or else I wouldn't have noticed it. I was definitely not in the habit of doing breast self-exams. I don't know for sure that I had heard breast self-exams, and it's not like my family is super vigilant about this or anything. My mom's mom had breast cancer when she was in her 70s, but it's not like, my mom or aunts or sister or anything had cancer, so I was, on the lookout for it. I definitely was not. And so I think I started to notice the pain in about August of 2014, and I could kind of feel something there, a blob of some kind, and I didn't know if it was normal. Since I had never really done self-exams before, I didn't know what my normal was, and so there's nothing to compare to, and even trying to compare to the other side that didn't hurt, I still just wasn't sure what I was feeling and if it was normal. So I just sort of ignored it, and the internet lured me into a false sense of security, I guess, because I was like, oh, well, it hurts, that's awesome, it probably is nothing. So anyway, then I was on crutches for a few months and was super ignoring the pain, because I was trying not to slip and further screw up my body by falling in snow in a Colorado parking lot. So it wasn't until after I was off the crutches and I had kind of a month of just being like, everything's back to normal, which is sad to think about now. But then I was like, this just keeps hurting, and it was really distracting, even if it wasn't anything wrong necessarily. It just hurt and it was uncomfortable, and so I decided that I should probably get that checked out. And so I went to my OBGYN, and she did a physical exam, and from that she scheduled me for an ultrasound. An ultrasound is not the most well-known method of kind of looking for breast cancer or anything like that, but since I was so young and wasn't doing a mammogram or anything like that, I think ultrasound was just kind of the easier option. I've run into that a lot during my years in this industry, that ultrasound is cheaper, there's no radiation involved, and so often it's kind of the go-to, and if an ultrasound shows something suspicious, then they'll go to something further. But anyway, I had an ultrasound, and I guess that looked weird enough that the same day they had me have a mammogram. And I want to give a bit of a public service announcement pro mammogram. I've heard really worrying statistics that a lot of people get their cancer diagnosed much later than they could have because they're scared to go to mammograms because they hear that they hurt a lot. And while it's definitely uncomfortable, it's not something that you want to do, getting a mammogram is so much better than the alternative. The earlier they can catch cancer, the better. And so I would just encourage anybody who, like, as soon as your doctor tells you to start getting mammograms, I would just really be a proponent of getting your mammogram, and the brief pain is well worth, getting your diagnosis or getting your hopefully your clear bill of health. So even on the day that I had my mammogram, really the technologists aren't supposed to say anything, because they're trained to, run the machine, but they're not radiologists. But my technologist that day kind of threw that little rule out the window, and I'm honestly grateful, because she just pointed out to me that there was a spot on my breast that was kind of like curved up, and she told me, like, that's kind of characteristic of cancer. I would prepare yourself for that news. And I was like, okay, good to know. But I did understand, and I looked into that a little more when I left, and I did feel like, okay, this does look like it could be breast cancer. So I started to kind of just assume that it was, and I figured that if it wasn't, I'd be pleasantly surprised, and if it was, at least I was forewarned. So the mammogram, I guess, was also questionable enough that they sent me for a biopsy. That was a different day, and I had an ultrasound-guided core needle biopsy, and had to wait over the weekend for the result, which was annoying. And I made the dumb decision to go to work that day. I thought that it would be a good distraction, and I'd get stuff done. I'd forget about the news I was waiting for, and I did not at all. I was completely worthless that day, and would be in the middle of trying to work on my project and just start crying. And the two people at work who I had even told about what I was going through and what, about the biopsy and that I was waiting for this news, they weren't in work that day. So I was just a complete mess of a person, and I was just an island. It was terrible. It was much better once I finally just found out. Like, definitely I was upset, and that was a hard day, but I always feel like it's better to know than to not know, and waiting was much worse than just knowing. I'm gonna go into, like, my surgery and pills and all those things in a later video, but the other topic that I wanted to address here was why I got cancer, because that's kind of usually what follows after people find out how I found out that I had cancer. Like, oh my gosh, why did that happen to you? And similarly, 4 years ago, that was immediately where people went, because I was such a weird case. And the first step that they always do is genetic testing. There's one genetic mutation in particular called BRCA, or BRCA sometimes, that people who have that mutation often get breast cancer young. So they tested me for that, and I actually didn't have it. And so then that sort of just put me in the, like, who knows category. But unfortunately, a lot of people took that as, like, open season. Let's diagnose Kaylee and figure out why she had this. And I don't mean, like, medical people. I just mean, like, randompeople.net, who I do understand the sentiment. Like, people want to know why I got cancer so that they can feel reassured that they won't get cancer. But it ended up making me feel really, like, bad about myself. Like, people were scrutinizing my every decision for my whole life. People pulled out the weirdest things. Like, I used to be a diver, and so I spent a lot of time in pools, and so one person said, like, oh my gosh, well, maybe, like, chlorine, like, leached into you and screwed something up. And other people came down on, that I had been drinking water straight from the tap, or I had been eating food that wasn't organic for my whole life, live in Colorado, and, radiation issues and stuff with altitude. And people also, a fair amount of people were like, oh, well, you should just not eat sugar anymore, because people have this idea that sugar causes cancer, makes cancer worse. And I actually do want to read something about that really quick just to clear this up. This is from Frequently Asked Questions from Mayo Clinic's website. And they say, sugar doesn't make cancer grow faster. All cells, including cancer cells, depend on blood sugar for energy. But giving more sugar to cancer cells doesn't speed their growth. Likewise, depriving cancer cells of sugar doesn't slow their growth. They go on. I can post a link to that page. It's a lot of really good information. But people get confused maybe because PET scans, which is something that I'll address in a later video. But anyway, a lot of people are like, oh, well, you should never have had sugar in your life and you should never have sugar now. And so I just went through a really hard time of being scared to do like anything or scared to eat anything. I thought that anything I did was going to make my cancer worse or make it come back after I had surgery. And it just makes me think of, there's a Friends episode where Chandler finds out from Monica and Ross that their parents don't like him, and Chandler is trying to find out why. And between Monica and Ross, they come up with all this speculation. They're like, well, maybe it's because you make jokes all the time, and maybe it's because you do this, and maybe it's because you do that. And Chandler eventually snaps, like, if you don't know, don't just make up the reason, because he felt really attacked. And I think that's how I felt, that I already felt like there was something evil in my body, and then it made me feel like, what's wrong with me? Am I bad? This hateful thing is in me. What does that mean about me? And it just was this huge like existential crisis of feeling like I was a bad person. And so I would just say that even my doctor doesn't know I got cancer, and the reason I got cancer is just that cancer exists and people get cancer, and I'm people. I'm not special. I'm not immune to cancer. And statistically, it's going to be someone. It's like a lotto ticket, but for something that nobody wants. That it's got to be somebody, and there are always outliers in statistics. It doesn't matter that I don't fit any of the risk factors that they've come up with. There are going to be random people who get cancer, and even just like a month or so after I got my first surgery for cancer, I read about a little girl who was like 6 or 8 or something who got breast cancer. So yeah, cancer is just, it's kind of a horrible mystery. I was just at Duke for my master's degree, and there's so much cancer research, as I mentioned in my first video. Some of it is about treatment, some of it is about diagnosis, and some of it is just even still like, what is cancer? How does this happen? Why does the body kind of like revolt in this way? So the reason that I got cancer is just randomness and kind of butterfly effect kind of thing. Probably a lot of factors that played into it, and some just dumb luck. But I think all I can do is, try to deal with, my life as it is, and try to be wise about my decisions, and try to be kind to people, and to still realize how lucky I am and how much worse life could be. I have such good doctors, such amazing friends and family, and everybody wants to help me feel better, which is lovely. I mean, it's so nice that people care and nobody's trying to hurt me. And I just think of wars and how much violence and horror goes on in wars and stuff, and I'm just like, man, compared to that, I can't really complain about cancer, because I have so many people who are trying to help me, and in this day and age, I will get the best treatment that there is, which is just an incredible stroke of luck on my part. So anyway, thank you for watching this video. If anybody has questions or comments about this video or an idea for a future one, I would love to hear it. Thank you for watching. Bye.